I recently got PRP treatment for acne scars. Are PRP facelifts permanent, or is it like a thread lift?
Thank you for your question. You stated in your question, which wasn't accompanied by any photos, that you recently got PRP treatment for acne scars. And then you're asking, are PRP facelifts temporary like thread lifts? So I think there is definitely an opportunity here to give you some explanation as to the philosophy of and the role of PRP as it has in my practice when it comes to acne scars and how it relates to other modalities that you may feel are temporary. To give a little bit of background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I treat a lot of acne scars in my practice. We have the full range of modalities to help people with acne scars, from skin products to microneedling to several different laser technologies, as well, of course, as surgical or as well as minimally invasive procedures. So to understand maybe a little bit about acne scars before we look at whether or not it's temporary, you have to understand what was the mindset of the doctor and you when it came to treating the acne scars with PRP. When I talk to patients about acne scars, first I spend a lot of time on their evaluation. The understanding there are basically three types of acne scars, and those include ice pick scars, boxcar scars, and rolling scars. It's very important to identify both through standardized photography and backlit photography, at least in my practice, the way I evaluate people, to look at what kind of scars you have. And then there's a bit of a mindset as to the options you have and how to treat those different types of scars. Now, I can say that PRP, through its mechanism of action, which is to stimulate collagen, to stimulate blood supply, which is basically a global textural improvement of skin, as well as if it's injected under the skin to stimulate the fat, as well as to deal with some of the scarring under the skin, does have long-term benefit. When you ask if it's temporary, it's not that it's temporary, it's that it's part of a treatment plan. When I speak to patients about acne scars, I often talk about a more global plan because there never is a single modality that can treat everything and have you reach your potential. Unfortunately, when you deal with acne scars, you're dealing with one common issue: tissue loss. And with tissue loss, there has to be strategies that are customized to each individual to optimize the smoothing, maximal smoothing of the skin. And unfortunately, the limitation is that you can't ever achieve completely flawless skin, but you can achieve a lot. And often it's not just a single treatment, but it's rather a series of treatments. And in my practice, I like to evaluate the effectiveness of a particular treatment and then discuss strategy for future treatments. I always explain to patients who come with acne scars that you can't expect a single laser, and this is unfortunately what happens. A lot of patients who have acne scars will bounce from doctor to doctor trying to look for the latest, greatest technology, and unfortunately there's usually not one perfect solution. And really the doctor you choose should have a lot of tools at their disposal and a lot of experience to help you achieve your results. As far as thread lifts are concerned, I don't think there really is much of a role for any type of non-surgical skin suspending modalities, but I understand that you want to make sure that you get the most, quote, permanent solution. Understanding that you are not permanent and that there is an aging process and there's also your tissue response to the treatment, that's also a factor in how successful the treatment is. In our practice, I often combine for, let's say, atrophic scars, a combination of PRP and hyaluronic acid filler. There's a good synergy in that, and then it helps to build up the scars there are atrophic scars or rolling scars that, and I often do combine that with subcision or release. But since there's no photo, there's no point in being more comprehensive. But understand that PRP does offer some degree of permanence, but it's still not an endpoint with one treatment usually. So talk to your doctor who did this procedure for you, learn more about what is reasonable expectations with this and other modalities, and come up with a plan that makes sense for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.